We have 6.5 million babies every year. 250,000 of them die within the first month of life every year.
Some of the women, they do apply something like toothpaste, cow dung. They apply cow dung to the umbilical cord, and it could be a media for infection.
Culturally, the women want to apply something. They want to be seen to help the babies until the cord separates.
We came all the way from Nigeria to Nepal to understudy the utilization of Chlorhexidine application on the umbilical cord of the newborn baby. It is really helping in preventing neonatal sepsis to children.
For us, this is very important. We know this is an intervention that we can quickly roll out so that we can reach as many mothers as well as many babies.
Lumos was able to demonstrate corporate responsibility, that I'm not in this business to make only profit, but I'm there to contribute. This is a product that is going to be applied on neonates. Their level of immunity is still very low, and we have to make sure that the product that is going to be used is of good quality.
Nepal has a long history of volunteer workers in their health system who are doing a great job, where they identify every pregnant woman in their community and they advise them to register for antenatal care. They ensure they actually register.
The way they use the female health volunteers is very commendable, in the sense that in any community, they know those that are pregnant, and the time is 8 months, they give them the chlorhexidine, and when they are going to the hospital for delivery, they have access to chlorhexidine.
In Nigeria, we found that volunteerism is not a very easy thing to get done. But what I see from the Nepal lesson is that it's not actually, they're not working full-time, and I think that's a basic difference between what we've fashioned as our village health workers in Nigeria, who we're going to pay. It's like a calling for them. But I think it's been almost impossible for some of the ones we've seen to give up this job. I think the respect they get from the communities, the sense of giving back to their communities and helping to save lives is something that's been immeasurable.
We do have a lot of women, particularly in churches, who would like to take it as part of their evangelization processes, where they go by into communities and help women.
Thank you very much. When we get back home, we'll look at the possibility of which is the best way can we distribute it amongst the community. It's going to be very easy for my own state to just include that item into our essential drug list for free medical care.
I believe that if we can ensure that we institutionalize the use of chlorhexidine at a facility and at the community, I definitely know neonatal sepsis through cord care infection gonna be reduced.
I'm so excited, and I'm thankful to Nepal for giving us that opportunity. Immediately we arrive back in the country, we will start the next steps so that we can share with other countries. When they see Nigeria start and succeed, I tell you the whole of Africa will begin to roll out chlorhexidine. For every 5 Africans, Nigeria is 1. And so if we do well, Africa will do well. And we believe that Africa is waiting for us. We cannot afford to fail Africa. We cannot afford to fail Nigerian mothers and their babies.